Hi, thanks for joining us and the future of connected healthcare, operationalizing privacy and security. To start with, I'm with ClearData, and I'll introduce myself as Wayne Sachs, the Vice President of Solutions Architecture. ClearData is a premier consulting partner of AWS, and we focus exclusively on healthcare and life sciences workloads in the cloud.
Good morning, everybody. I'm David McCutcheon. I'm the COO at Infobionics. Our primary goal is to deliver the best patient experience and healthcare provider experience for remote cardiac monitoring. And I'll get a little bit more into about our product and why we chose ClearData and AWS in just a few moments.
So we want to talk about healthcare's digital acceleration and vulnerability in post-COVID-19 economy. So something that we're all familiar with is the industry's move towards transforming into a digital capacity. So we know that with COVID-19's emergence, the trends that had started have really picked up steam. Virtual care is now a norm. Interoperability across a multitude of previously siloed applications is now necessary. Reliance on the digital front door is an expectation of our customers and our patients. And the rise of retail health being driven by the experience of the consumer economy that all of us have come to sort of rely upon over the last few years. So all of those trends have encouraged customers to come look at ways to move to the cloud with safety, security, and compliance in mind. So our customers choose ClearData because we are healthcare specialized, because we have particular expertise in security compliance in the cloud, because we're HITRUST certified, and we help our customers get to HIPAA compliance and HITRUST inheritance, and because we're a platform-enabled managed services provider. Ultimately, our customers need their cloud workloads to be continuously compliant and secure. They need to start secure, and they need to stay secure. And so Dave is going to talk about his product and his company and why they ultimately chose to work with ClearData and AWS.
Good morning, everybody. As I mentioned, I'm with Infobionics. So the first thing is just a little bit about the company. So we have a device called the MOMI. It looks a lot like this, which also looks a lot like a mouse. But it stands for Monitor Me. So we have a platform called MOMI Now, and we have a device called the MOMI. So we do all 4 remote cardiac monitoring modes. So we call it a 4-in-1 device with full disclosure data. And that sort of makes us unique. So this same device can do a traditional Holter, an extended Holter, an event, or an MCT. The device actually has an integrated cell phone inside. So we're streaming the data over the network, encrypted HTTPS, to our server where we apply AI. We notify physicians when the AI triggers an alert that it's found a dangerous arrhythmia. Our QC techs confirm that arrhythmia, and then the physician will get notified. When we think about moving forward in healthcare, one of the challenges we had as a small company is how do we scale? We couldn't really think about going on-prem at all time, and everybody wants their data secure. So what we're able to do is, as a healthcare company, and with patient focus and with outcomes focus, we're able to put all of our efforts into developing the devices, the software, the AI, and then leave the heavy lifting of the compliance and deployment to a partner like ClearData and with AWS. So, when you think about our journey from the very beginning, one of the things we knew is that we couldn't keep up with the rapid changing IT environment and to scale our staff to support on-prem deployments. One of the other challenges we had was that we were looking for a partner that could help us achieve certification. So that's what we've done with ClearData on AWS. Having both the security HIPAA layer with AWS and CloudWatch, as well as the safeguards from ClearData, allows my development team to focus on what really matters, which is the outcomes, and not have to worry about all of the compliance and security. I think we've all seen the data, something like 50% increase in ransomware attacks and cyber attacks in healthcare. I know of multiple healthcare facilities that have had to pay big ransom dollars just in the Boston area. We don't have those kind of problems. I can sleep really well at night knowing that I've got these partners wrapping my solution. So we're talking about COVID-19 and the post-COVID approach here, right? And so what we actually went through was a huge downturn. I'm sure most of you know all these facilities closed, right? Outpatient facilities. That's one of our largest market segments. Patients couldn't go to the office, they couldn't get one of these devices. So what we did is we decided to rapidly deploy some new solutions, including what we called a remote me. So we started shipping the devices directly to the patient, and we integrated with multiple EMRs rapidly. By being in the cloud, we were able to use an interface engine, and then we actually tripled our EMR integrations in the first half of COVID, and we're 7 times the number of EMR integrations today from the beginning of COVID. We saw a quick downturn in utilization just because no one could get to the offices. Physician offices closed. Many of them went bankrupt. They couldn't get patients, they couldn't reimburse, and so it was a challenge. We also decided that there's some things going on with COVID. There was early treatments where there was a question, could these treatments cause cardiac arrhythmias? So we developed an algorithm for QT prolongation. So during clinical trials of some of the medications, we were able to provide tool set that allowed physicians to accurately and completely monitor their patients for any dangerous arrhythmias while they were taking these types of medications. So I would say that, as we looked at coming out of the pandemic, and now we're post-pandemic, we've got a mix of providers who are still using that mail to patient and register through the EMR and get results out. By focusing on the clinical side and letting our partner take care of what we call the heavy lifting and the scalability, it's been really a great solution. I think one of the things that happened was I talked about that downturn in utilization is we saw all of our utilization on whether it was compute, so our EC2s and our S3 storage buckets, we saw a drastic decline in utilization. But because we had the right kind of partnership with AWS and ClearData, they had already configured us so that we were using on-demand resources. We were able to quickly and allow the system to scale up and down, spin up virtual machines up and down as we needed for our AI. So actually our compute costs did not rise as we came out of the recovery. So over 2022, we've seen 40% increase in the number of patients registered and using MOMI, but we did not see a commensurate rise with our cost. So having the right partner, putting it in the right infrastructure, having the right security wrapper for a small company like ours, it's great partnership, and I can't give enough accolades to both the AWS team, who supports us, and to ClearData, who also supports us. And we'll move on. I'll let you close out, and I'll take any questions at the end. Thank you very much.
So I want to also talk a little bit about how the partnership between ClearData and AWS has worked. We find it absolutely critical for our success to be on top of the AWS cloud. Because at the end of the day, AWS operates this global infrastructure. It provides a suite of services that are HIPAA eligible, and none of the work that we do, focusing on security and compliance, would be possible without the building blocks that AWS provides us. And through the partner organization, our solutions architects, and the incredible service team support, we're able to meet the needs of our customers combined as an AWS ClearData team, in support of what we all believe is really important, which is making healthcare work better every single day. And so the things that Dave and his team have been able to benefit from are the way the ClearData platform is constructed. And so at its core, the ClearData platform is a compliance engine, and it understands the regulatory and legal requirements and applies those requirements to the end state technical services. And then David and his team take significant advantage of the operation of the cyber health platform, which is a SaaS solution, continuously monitoring and applying guardrails to the services so that he starts compliant, he stays compliant. Layered on top of that is our managed cloud operations, which ensures that Dave's infrastructure remains patched and safe. It's got security applied to it, along with the managed defense organization, which is a healthcare-centric, healthcare-focused defense in depth capacity, ensuring that bad events don't affect ultimately Dave's infrastructure and ultimately his customers. So we want to thank you for joining us, and we'll take some questions off to the side at the end. Thank you.